Woman slowly dying with months to live makes desperate plea for transplant. Mirror Online. Sunana Paul, from Birmingham, needs a liver transplant and fears she may die before she manages to find a match. A woman who is endopo. Slowly dying endopo. And has just month. Sunana Paul needs a liver transplant and fears she may die before she manages to find a match. Tragically, the 31-year-old, from Birmingham, has deteriorated alarmingly in past few months. To make matters worse, Ash has rare blood type B, drastically restricting the chance of a donor. Next spring, all adults will automatically join the organ donation register but for Sunana that's too long to wait. When asked how long she could have left, she replies, "How long is a piece of string? I might not get it in time. I have to face that. My liver might not survive for another 6 months. I take a day at a time." According to the NHS organ donation website, 6,278 people are currently waiting for a transplant in the UK. Further statistics state that although there has been an increase in the proportion of registrations to the organ donor register for those from an ethnic minority background, all minority groups continue to be underrepresented. Between April 1, 2019 and March 31, 2019 there were 270 actual donors from an ethnic minority background out of a total UK population of 66 million, whilst 1,883 patients awaited transplants. Born with biliary atresia, which blocks the bile ducts so bile builds up in the liver and damages it, the clock has always been ticking. An operation at Birmingham Children's Hospital when she was an infant helped slow that clock. But in February this year, Sunana, who lives in Edgbaston, became more ill than ever before. After fighting sporadic liver infections since she was 16, often lasting months at a time, the recent bout has proved the final straw. "Usually I have 2 weeks of intravenous antibiotics and it's fine," says Sunana. "I had that and came home, and they put me in oral antibiotics. It was supposed to be a 6 to 8 week course. But I just got the infection back and even worse. That was February and I am still on them now." Matters have reached the stage where only a liver transplant offers the chance of a longer life, but so far the outlook remains bleak. "I was really optimistic in the beginning," she says. "I thought I would have it. I am trying to be positive, but I am also trying to be realistic because I don't want to lie to myself. It's not just me that's out there who has this rare blood group. I know there has got, some doctors seem really positive and believe I can get a liver. Other doctors are the first time I heard that, I think I was in a bit of a shock. I don't really cry." Despite her brave smile, Sunana is suffering badly. "I'm always in pain," she confesses. "Constantly. If anything, I moan about the pain because the pain is just ridiculous. It's like 8 and 9. When they look at me, people are like, 'Oh, you look amazing. How can you be ill?' I look okay, but inside I am slowly dying. It is what it is. I try to see people. Besides, if I am in pain or feeling really sick, I don't want to do anything anyway." Most of the time when Sunana is alone, she thinks about the possibility of a transplant. She thinks about it. "It's a horrible situation because I know that someone has to pass away to be able to give me life," she says. "It's something it's just not nice someone having to pass away in order to save me. I think until it happens to maybe a family member or a friend, you don't realize how important it is to save someone's life. In general, we don't donate as much as we should. I don't really Sunana has had to grow up biliary atresia and has fared better than some," her mum says. "She was my first child," says Cyan Paul, 52. "I had no idea she was jaundiced. The nurses basically, on an Asian person jaundice is completely different. She had a green after 5 days it didn't settle. A month went by. By the time she was 6 weeks old, my health visitor said we should see somebody else about it. Suna Ina's case was referred to Birmingham Children's Hospital where she was admitted as an urgent case, rushing her infant body into surgery for corrective treatment. The operation, known as the Kasai procedure, would act as a temporary measure to re-establish bile flow from the liver. Devastatingly, biliary atresia cannot be cured, but this procedure was the best way of treating the disease if done as early as possible. In Suna Ina's case, she was lucky, says Cyan. She has gone on up, she has managed to somehow fight back all these years. I didn't know the enormity of what was going on. I had her at the age. I don't think I am prepared even now, and I am a lot older. Although many Black and Asian patients are able to receive a transplant from a white donor, for many the best blood and tissue match will come from someone of the same ethnic background. Sunana is using her story to campaign for those from a minority ethnic background to register for organ donation to save a life just like her own. It may not be in time for her, but it will be a lifeline for others.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.